On August 20th, the International Day of Medical Transporters recognizes the people who move patients to and from places of care. For many, this immediately brings to mind flashing lights, the speeding ambulance tearing through a city intersection. And companies often recognize the date with an easy routine, a few dedicated hashtags, branded social media posts, and maybe a voucher for a free cup of coffee. But navigating complex physical environments, operating heavy accessibility equipment, and managing constant safety risks on unpredictable roads requires actual systemic support, not a public relations campaign. A spot on a specialist's calendar holds zero value if a patient lacks a safe way to travel the 5 miles from their front door to the clinic. This image shows a complex clinical environment, complete with specialized equipment and dedicated staff. But before any treatment can occur, the physical logistics of getting a person out of their home, into a vehicle, and safely through those hospital doors have to be solved. Medical transportation is the mandatory physical bridge making the delivery of ongoing healthcare possible. This diagram maps out the modern medical transportation industry, showing it branches far past 911 emergency response. Down one branch, internal hospital staff navigate miles of corridors, ensuring patients safely reach imaging departments, operating rooms, and discharge bays. On another branch, couriers manage strict timelines to deliver laboratory specimens, blood supplies, and specialized surgical equipment. But the massive volume of daily scheduled care falls under non-emergency medical transportation, or NEMT. These drivers take patients to dialysis, chemotherapy, and physical rehabilitation. Applying a single generic label to all these professionals erases the distinct legal responsibilities, safety protocols, and technical training each unique role demands. An NEMT trip starts with rigorous pre-trip inspections. Drivers test mechanized wheelchair lifts, check heavy-duty floor tracks, and verify specialized occupant restraints before they even see a passenger. Loading involves strict communication protocols. Before touching a mobility device or lift, the driver must verify securement points and apply correct tie-downs. On the road, harsh acceleration or sudden braking can injure a passenger recovering from surgery. Drivers execute smooth, defensive maneuvers to maintain absolute stability in the vehicle. Many contracts mandate strict origin-to-destination service. The driver legally must escort the passenger into the facility and complete a formal handoff to authorized medical staff. Operating the steering wheel is the easiest part. The job is a continuous sequence of risk mitigation and strict safety compliance from door to door. Yet tight margins and compressed schedules pit these safety standards against intense, profit-driven operational demands. Dispatchers routinely pressure drivers to complete routes with malfunctioning wheelchair lifts or to rush slow-moving, vulnerable passengers to make up for lost time. Society cannot authentically celebrate these workers while remaining silent on the systemic operational pressures that actively put them and their passengers at risk. August 20th should operate as a strict industry-wide operational audit. Clinics and hospitals must ensure a patient actually has their discharge paperwork in hand before marking them ready for pickup, and accurately request whether a patient needs a wheelchair van or a stretcher. Fleet managers and transport providers have to supply fully maintained safety equipment, pay drivers for all hours worked, and guarantee protection against retaliation when a worker refuses to drive an unsafe vehicle. Passengers and their caregivers must accurately communicate specific mobility limitations and oxygen requirements during the booking phase so the correct vehicle arrives. True safety requires active participation and accountability at every single point across the healthcare supply chain. Whether it is an emergency responder stabilizing a trauma victim, a courier moving a lab specimen, or an NEMT driver taking a neighbor to dialysis, the core objective remains the same: delivering a vulnerable person or vital resource to its destination safely. A medical transporter physically connects a patient to their medical care. Defending their working conditions, their dignity, and their safety protects the integrity of the healthcare system.